The pharynx is a muscular tube running down the back of the throat. It has a wide tendon in the back that's an attachment point for the pharyngeal muscles called the median pharyngeal raphe, or the pharyngeal aponeurosis. The pharynx is important to some sounds in English, like low vowels and the sound, where resonance in the pharynx is an important component of their acoustics. The pharynx is used more in other languages, like the Arabic languages and Native American languages, for distinctive consonant sounds. The pharyngeal muscles consist of a set of constrictors, the superior, middle, and inferior constrictors, as well as a couple of muscles that act against constriction, the salpingopharyngeus and the stylopharyngeus. The superior pharyngeal constrictor muscle originates from the pterygomandibular raphe, that tendon that runs between the sphenoid bone and the mandible, courses backwards to insert into the median pharyngeal raphe, so it forms the sides and back wall of the nasopharynx. Contraction of the superior pharyngeal constrictor will help pull the rear pharyngeal wall forward to assist the levator veli palatini in closing entry to the nasal cavity. This will also help constrict the upper pharynx during the sequence during the pharyngeal stage of the swallow. The middle pharyngeal constrictor originates from the horns of the hyoid bone and the stylohyoid ligament. It courses upward and backward to insert into the median pharyngeal raphe. When contracted, the middle pharyngeal constrictor will reduce the diameter of the oropharynx. For speech production, this would create a constriction within the pharynx that affects speech acoustics. During the swallow, this would help the food bolus continue along its pathway from the oral cavity through the pharynx and down into the esophagus. The inferior pharyngeal constrictor originates from the lamina of the cricoid cartilage and the oblique line of the thyroid lamina. This muscle is divided up into two parts, one called the cricopharyngeal muscle and one called the thyropharyngeal or thyropharyngeus muscle. These muscles course upward and backward to insert into the median pharyngeal raphe, so they would constrict the lower oropharynx and the laryngopharynx. That cricopharyngeal part of this muscle controls the opening into the esophagus. Here's a different view of those pharyngeal constrictors, superior, middle, and inferior, relative to the tongue, the jaw, the hyoid bone, and the thyroid cartilage, just to give you a little bit of an idea of their position in the pharyngeal cavity. Broadly speaking, I think of the superior pharyngeal constrictor as in the nasopharynx region, the middle pharyngeal constrictor in the oropharynx region, and the inferior pharyngeal constrictor in the laryngopharyngeal region. The salpingopharyngeus is one of our unconstricting muscles for the pharynx. It originates at the opening of the eustachian tube in the nasopharynx, courses downward and joins in with the palatopharyngeus to insert into the median pharyngeal raphe. Contraction of this muscle will elevate the pharynx, and also by pulling on the sides, the lateral sides of the pharynx, it will undo the action of the constrictors. The stylopharyngeus muscle originates at the styloid process of the temporal bone, courses down and in to insert into the superior and middle constrictors and the posterior part of the thyroid cartilage. This muscle will also elevate and expand the pharynx to work in opposition of the constrictors, because it's coarse coming from the sides of the skull behind the ear downward and medially to insert into the sides of the pharynx. Muscular activity for the pharyngeal muscles will primarily be for swallowing for us, but in some languages other than English, there is a fricative or other similar consonant sounds that are produced in the pharynx by approximating the tongue root to the posterior pharyngeal wall. Among our three pharyngeal constricting muscles that would aid in this articulation, I think the best answer is the middle pharyngeal constrictor, which is primarily in the oropharyngeal region, and so most likely to have a use in speech production, apart from controlling the distinction between oral and nasal speech sounds, where the superior pharyngeal constrictor would be relevant. In discussing the inferior pharyngeal constrictor, I mentioned that the cricopharyngeus controls the opening to the esophagus. That upper esophageal sphincter is an important component of our digestive system, which we study in terms of chewing and swallowing in this class. Opening up that entry into the esophagus could involve either contracting the cricopharyngeus muscle or relaxing the cricopharyngeus muscle. In this particular case, the cricopharyngeus muscle is generally contracted at all times to keep that sphincter closed, and it is relaxed to open the upper esophageal sphincter up to control entry into the esophagus. This is in contrast to, for example, the tensor veli palatini, which contracts in order to open the opening into the eustachian tube. So it's physiologically possible, anyway, for either contracting or relaxing a muscle to open up an entry into something. In the case of the esophagus, it is a relaxing action that opens up that passage.